My name is Diana Kovalev, and this is a chronic illness about alcohol addiction.
So, alcohol addiction is the brain functions on a delicate balance of neurotransmitters that, when intoxicated, there's a disruption in that balance. For example, the first signs of alcohol introduced to the brain would create a high amount of neurotransmitters, which would create that effect of euphoria and almost a pleasurable effect. Over time, the brain adapts to these changes, and it requires more alcohol to get that same effect of euphoria. The neurotransmitters are depleted, so the brain begins to tolerate the amount of alcohol. Over time, the person then can't live without alcohol. Alcohol dependence is also associated with withdrawal. If the person can't live a day without alcohol, without drinking at least one drink just to settle their nerves, they're going through agitation, they're being everything's irritating them, then they're going through withdrawal, and this is a sign of addiction. The person experiences withdrawal when they abruptly stop drinking. Not all alcohol abusers become full-blown alcoholics, but it's a big risk factor that drinking alcohol might lead to that. For example, people who do it for certain reasons, like to fit in socially, to cope with life stressors, alleviate pain, go to sleep. Most of the times it's because of a stressful change, such as a breakup. Research also shows that it might be a genetic predisposition as well. That is a risk factor.
The search terms that I used to begin this project were I was putting myself in the position of the patient. What would I look for when I'm trying to find more information about this affliction? I would use Google search terms. What is alcohol addiction? What is addiction to alcohol? YouTube results, like inspirational stories, and then images of what would come up if I researched alcohol addiction. I wanted to use these three things, which is cover all of the bases, if not most of them that could be on the internet. I was expecting to find, links to support groups, textbook definitions, associations, for help sites and all this stuff, community resources and things like that. So when I Google searched what is addiction to alcohol, I chose the first website that would pop up because it'd be the simplest thing to do if I were a patient. Luckily, we had a website from an organization pop up too. So this is helpguide.org. This is a website that shows, the signs, symptoms, and then help for drinking problems. This was a very informative website, I thought for myself, was because the sidebar links to a lot of other things that could help the alcoholic after they've read the information about, yes, these are the symptoms I am experiencing. Yes, I am an alcoholic. The sidebar says that they can find treatment programs and self-help as well. The site really helps the person to understand and personalize the diagnosis to what they actually are experiencing too. So at the very end of the website, there is help for someone who's looking to help someone they know who is an alcoholic. Also, the website is very professional and it's not taking sides. It gives factual information and then help as well. So I feel like it's not going to label an alcoholic and have them turn away from this help that is presented to them. So when you research on YouTube, most of the results that come up are alcoholics testifying about their journey to sobriety. You get a lot of ex-alcoholics. They express their struggles, their temptations, and hearing their stories can help bring a sense of reality to that alcoholic's journey to sobriety. It's very inspirational, and if these people can do it, then they know that there is hope for them as well. What was surprising is that many of these stories, the individuals started drinking from an early age. The first one, the gentleman started drinking at age 15. The second one, his name was Noah, he started drinking at age 13. And both of them started because of a social thing, and then later they began to drink by themselves, and then they started to hide their problems. They state that the most important thing that helped them overcome their addiction is to admit that they had a problem. They all said to take it one day at a time, and that's how they did it, small steps. That first moment of being drunk gave them a feeling of being comfortable and free. And then afterwards, they spend their life, their most of their time trying to recreate that moment of pleasure. They share that they would drink to get rid of their problems, and that it always led to more problems. So then they became functional alcoholics. The gentleman in the video, the lower video, he had a job and he had a girlfriend, and that he would drink after his girlfriend was asleep so that she wouldn't know what he was doing, and that he'd be depressed, he'd be anxious, and it just wouldn't take away that anxiety or depression, but he would start hiding it. But then he's been sober for a year because he decided to take the initiative to go to rehab. The third search term that I used was through Google search images of alcohol addiction, and a variety of things came up. I decided to use images because it brings sort of full circle to say if a patient was Googling most of this. You not only get factual information, but there's also videos, and then here's images. A lot of things came up. There's images of healthy brains versus alcoholic brains. There was before and after pictures of people who were addicted. There was quotes, inspiring quotes, that were a lot of inspiring quotes, which was very nice to see because the patients need to know that they're not alone, and then they can stop drinking, then they can take action. The surprising thing about the search was that the amount of images that came up that were depicting alcohol as a burden, like that little man who's chained to the bottle. There was a lot of pictures like that where people were handcuffed, that they can't get away, that they were depressed looking as well. So that could bring a sense of personalization as well. Like, these people are also feeling that way, since like all the pictures are like that as well. The similarities with the book If You Have to Wear an Ugly Dress, Learn to Accessorize by McNamara and Kemper. The similarities between this reading and the search results that were for alcohol addiction was the fact that a lot of the things that Karen and Linda went through socially, alcoholics go through as well. For example, Karen and Linda, they could not go to work. They had to take leaves of absences just to regain their health. And Linda also went through a divorce because her husband couldn't understand what she was going through. Same thing with alcoholics. It's not the disease that is where I'm relating here, it's the fact that alcoholics indeed don't go to work because they're intoxicated, or they go to work while intoxicated and lose their job. There's divorces, they can't hold relationships because they're just not invested in the relationship, they're invested in their addiction. Page 36, Linda says that attitudes, thoughts, feelings, beliefs, moods, behaviors, and experiences are closely linked. This is very true with alcoholics because what they go through could be a reason why they started drinking or what keeps them continuing to drink. Page 42, Linda says that self-healing begins with making your own decisions. She was very saddened by the fact that her husband got his own realtor and he didn't consult her with it either. So she decided to get her own realtor, and making that decision brought back some independence for herself. Alcoholics can do the same thing. They need to make their own decision to stop their drinking and to get that help and rehab. That is a step towards self-healing. Page 55. Depression often accompanies chronic illness. Linda talks about how with lupus, that chronic illness, it brings about its own set of emotional symptoms. There's depression, anxiety, and that suffering. With alcoholics, depression could be already there and they are drowning it out by drinking, which gets them to be alcoholics. So that accompaniment of chronic illness with other emotional factors is very real. In that same book, there's actually big differences between the readings and what alcohol addiction is. It's not an autoimmune disease like lupus. It's not the same. Something like alcohol addiction has a cure. I think personally evaluating it is that the learning to accessorize part comes after sobriety. When the person is intoxicated, they're not thinking clearly. They're not using their full capacity to understand, yes, I need to be patient right now. They black out. They have, symptoms of their addiction. Learning to accessorize happens after sobriety. Keeping it, one step at a time, that patience and the understanding, the self-awareness to know that you can't go back to alcohol. That is what learning to accessorize would be for them. It's not the same thing as what these ladies are experiencing in the book. On page 48, Linda says that she learned to live a full life in spite of illness. This is different. I would say that the alcoholics learn to live a full life after illness, because like before I said, it has a cure and they can live that full life when they have stopped their addiction. On page 39, Linda says, until the diagnosis, I felt in charge of my life. Lupus took away her ability to choose how she wanted to feel. It would control her emotions. It would make her feel like she was suffering, and it would give her anxiety and depression. I would say this is different than what I researched here, is because alcoholics can feel this loss of control before they're even diagnosed, even after, and after they're diagnosed, and even after they've stopped and they've stopped being addicted to alcohol. They don't have that control in any part of that diagnosis. Before I started this research as a nurse, I've known my own fair share of what alcohol addiction can turn into medically. I've had patients with liver cirrhosis and hepatic encephalopathy where they're just not in their own mind because alcohol has, really messed up their brain. This research was more of like a personal journey of understanding why this happens and why they don't stop. In society, addicts are often viewed as morally wrong and even shunned as being bad people or sinners. But when you come to the bottom of it, it's a medical disease. According to many organizations, addiction is known to be a chronic and progressive brain disease that attacks and damages key parts of the limbic system and cerebral cortex, which in turn results in compulsive cravings, obsessive seeking, and irrational overuse despite harmful and devastating consequences. No matter what treatment or medication is prescribed, the change does not happen until the patient realizes what they are doing to themselves and those around them. They still have their, willpower, but the alcohol is something that's keeping them back. And the mind is a powerful agent that is physically altered by this chronic alcohol exposure, creating their addictive behavior. So when many people ask, why is alcohol addiction considered a disease? It's because of the manifestations it takes. It changes the brain. And just like it being a chronic illness, it takes therapy and medication to treat, but is very treatable. And it should be treated that way. Knowing that this is a very treatable addiction, after reading all of the inspirational stories and listening to what they went through, helped me also as a nurse to understand what they were experiencing. And throughout all the sites and web pages I looked, I found an interesting quote. Addiction is a disease, let's treat it that way. These are all people, and they're all patients who should be helped. And no matter how bad their addiction is or how powerless they feel, there is hope and help available, and that we should encourage them to not give up. Even if they've tried and failed before, it takes baby steps to overcome this addiction, and it's very possible.